All right, so let's talk about health problems of toddlers and preschoolers. Now, there's some things that, health issues and illnesses and things like that really go throughout childhood, but there are some things that do pertain specifically to toddlers and preschools, or that I would say are more common during this period of time. So, one of the things that we often see in the toddler and the preschool is sleep disturbances. Um, Very, very common. We talked a little bit about nightmares and night terrors in the previous lecture, but it's really common for toddlers and preschoolers to wake up through the night to be poor sleepers. And the caveat to that is that they really need good sleep. They have to have good sleep routines and get that good rest for their brains to recover and um, and to grow and to be able to sort of file away all of the knowledge that they are taking. So this is a prime time for those sleep disturbances, and these interventions and what you do for these kiddos depends on what type of sleep intervention it is, and a lot of it stems back to good sleep habits being formed early on and good sleep routines. A lot of these sleep disturbances can be corrected simply by instituting a good sleep routine before they even go to bed. Um, but it's going to vary depending on their age and what the disturbance is. Okay, contact dermatitis. We see this. This is eczema, another word for eczema, and we see this in infants, toddlers, preschoolers. We see all of these types of things, and very, very common to see. A lot of times it is an external sort of irritant that causes it. It can be on various areas of the body, and the best intervention is increasing moisturization. So lots and lots of moisturizing the skin and making sure that the skin doesn't get dehydrated, because that's oftentimes a cause, or it can exacerbate the contact dermatitis. Removing the insult. So if they're having some eczema due to certain laundry detergents or various things like that, making sure that you remove that as well. Human bites, they happen, especially in the toddler years. They do bite each other, and that's really common. The most common time you're going to see someone bite is when they are not able to verbalize. So most commonly it's the child in the toddler daycare room that is not talking as well, so therefore can't express himself or herself, and lashes out and bites. And then of course thermal injuries, burns, they're common in this age group because they're curious, they are exploring, and so they get themselves in trouble with different types of things. Okay, ingestion, again, another thing. Injury prevention is huge after the age of 1, right? Ingestion, they have no inhibition. So they're outside, they stick a mushroom in their mouth and they eat it from the grass. Foreign bodies. Okay, these, toddlers and preschoolers are the ones that end up in the hospital because they've swallowed something, or they have a foreign body that they've aspirated, and now they're wheezing, or now they can't breathe. They put foreign bodies in their ears and their nose. They put them everywhere. So very, very common. Cleaning products, cosmetic products. I'm always telling parents to make sure that these are up and out of the way so that they are not reachable. Just ingestion is prevention, because once they have ingested something, to go back and get them rescued, depending on what the agent is, it is extremely, extremely dangerous, and you don't have much time. Poison control is a place that's available for anybody to call, and I always give this number out to parents when I'm in the office, so that they have it on hand if their child does swallow something. A lot of times at the hospital, they will induce vomiting, and they'll use different types of things that they'll give them to absorb the toxin or to enforce them to vomit it out. It really depends on what it is. And if you go to work in the emergency room, you will see these things very often, where you are pumping stomachs, where you're giving various chemicals to induce that vomiting. So that's where you're going to see a lot of these kids that have this ingestion. Okay, heavy metal poisoning. I really want you to focus on lead. Lead and mercury as well. Interestingly, mercury occurs less often, but it is in food. And so, it's important that we avoid high mercury fish, that kids don't eat fish or seafood on a regular basis. Once a week max is really enough. This is particularly important for those families that have a vegetarian diet, that eat fish or seafood, they're the ones that are at high risk for this. But otherwise, just limiting and then having low mercury content. But lead ingestion is common, and we have it here in Jacksonville because we have parts of town that have very old houses. And so lead ingestion occurs when you actually ingest this lead. Now, it doesn't have to be eaten, and that's what I always try and stress. It can be inhaled, it can be be ingested via the mouth, but it really can be absorbed anyway. And the most common source of lead is lead-based paint. Now we have this in toys, okay? So it's not just old homes, we have this in toys. Now, it has been removed by, many places, but the thing about it is toys that come from other countries have lead in the paint. And it's very dangerous because what do babies do and young toddlers do? Well, they put everything in their mouth. And the problem with lead is that we know that lead leads to chronic anemia. Okay, so lead takes up the binding for hemoglobin, and therefore children that have high levels of lead, and basically no level of lead is normal in the body, but anything over 10 is considered diagnosable and treatable, I would say. Now, we don't do a very good job of it's a bit skewed in how we screen for lead, especially in Jacksonville, because all children that are on Medicaid have to be tested for lead. So in other words, they have to have a blood draw before the age of 2, if not by 2, if they are on Medicaid. So in other words, they're on government-assisted insurance. But what's interesting is oftentimes they do not meet the criteria for testing when you give them the lead screening tool. When you give some people, so in my practice, individuals that live in certain parts of Jacksonville that are old but of higher SES and more fluent, they live in older homes. So they actually meet the criteria for testing, but are not required to be tested. So it's a bit unbalanced, but we do have a screening tool that helps us differentiate who should be tested for lead. And the reason for this is because you can ingest this lead from various ways, as it's showing here on this slide. But long term, this causes anemia, okay? And it causes chronic anemia. So it causes changes in how hemoglobin is uptook. And therefore, we know that children that have chronic long-term anemia do have a lower IQ. And so it does affect their brain. And so Here's where I talked about the level of 10 or higher is going to be treatable. Okay, and screening for lead poisoning between the ages of 1 and 2. Yes, certainly by 2. Um, Chelation therapy is not as common. Those are going to be for the samples that are extremely high. Um, but most kids eliminate lead from their body naturally when the source of lead is removed. So that's the first intervention, is to remove the source of lead, and the body will eliminate the lead. Now it takes time, and that's what chelation therapy will do, is help sort of detox that, but it's not oftentimes instituted unless it's a very, very high level. This is just sort of an algorithm for what lead does to the body. So take a look at that. Okay, and then I'm just going to quickly talk about child maltreatment. So, the most common source of abuse is neglect, and this is an intentional neglect. And then you would have physical abuse, emotional abuse, and then sexual abuse. Now, oftentimes, if there's one source of abuse, there's multiple sources of abuse. And as the nurse and as the pediatric nurse, we are sometimes the first line of defense for a child. So a child is brought to the pediatrician's office, or the child is brought to the hospital, and it's our obligation to ask questions and to see if the story matches the injury. And that is the biggest thing that we have to remember. Does this make sense? And you guys know me and how I tell you to always follow your gut instinct, because your gut instinct will never lead you astray. Even if you ask more questions and the child is not being abused, you have done no wrong. Okay, so just keep that in mind. Physical neglect, of course, deprivation of food, clothing, all of those main things that they need to live. Emotional neglect, lack of affection, attention. Okay, you see this. And actually, you see this on a very minute level with, you see children showing signs of emotional neglect because of the increase in addiction to technology. And we're guilty. All of us are guilty of staring at our phones, right? Staring at our phones, staring at our computers, being obsessed with things. And we have these children that are watching this, and therefore we aren't talking to them. We're not looking at them. We're not playing with them. We're not interacting with them. And this emotional neglect, while it may not be considered abuse, it's becoming rampant throughout our entire society. Emotional abuse, of course, this destroys their self-esteem. So, we're telling them they're worthless, telling them that they can't do anything right, things like that. Physical abuse, this is that deliberate infliction of physical injury. And of course, children that are born to certain families and things like that. I think on my next slide I have that. No, maybe it's the next one. But there are kids that are at higher risk, okay? Shaken baby syndrome is when a baby is shaken. And so this is most typically a baby, colic babies are at high risk, babies that are developmentally delayed, babies that are neurologically already injured. So they have a certain cry that they have. So babies that are higher needs baby are much higher risk for shaken baby syndrome. And that's when the baby won't stop crying and the parent takes the baby and shakes them. There's red flags for that: broken retinal hemorrhages, injuries on the brain, on both sides of the brain, because the brain goes back and forth. And those are common findings in babies with shaken baby syndrome.